Okay.
So these are the families who are going to be a burden on our system should the disease get out of hand.
But again, it's important to know that we are learning that whilst initially the idea was that it is the elderly that are most vulnerable and being killed by the disease, the younger ones are also suffering the disease, even though the death rate, as far as younger people is concerned, is lower.
Yeah. No, and
they spread it more.
Yes, and the thing about this disease is not the death rate. People keep comparing the death rate to cholera, and that's not the problem. The problem is the transmission rate. Because the transmission rate is so high, people get sick and very sick so quickly. So if you look at the extrapolation they've done, even looking at the current case, and I was just using a study that the Harvard Medical School did, based on the current transmission rate that we have in Ghana now, and based on the extrapolations they've done, by the end of 30 days in Ghana, we should expect about 32,000 people with the virus exhibiting symptoms. That's at the current rate of 19 that we have. So if you have 32,000 people exhibiting symptoms, and all of them need medical care, just imagine the burden you are placing on your health system.
How do you make these estimations? Sorry I'm asking, but I've followed elsewhere, and I see how they make it quite close to what they expect. They know that this number of people will be infected, and we should work towards reducing that number or containing a certain number. How did you do that? What you just
did? Based on the latest extrapolation they've done, every infected person that is detected, there are about 10 more that are not detected. So if you even take, and the rate of transmission is 2 times, it doubles every 3 days. So even if you take the people that you've detected and extrapolate that they've infected twice that number every 3 days, you can get quite a fair estimate of the number of people who are walking around and going to start exhibiting symptoms in the next 30 days. And that's very alarming.
Scary.
And the fact is, at that point, you will need a lockdown. Don't forget that in that midst of that lockdown, there are people who need drugs, because there are lots of people on chronic diseases. There are people who would also get sick within that period. Just imagine you are